cholesterol does not cause heart disease. This is it. And forget about cholesterol, because of all the substances I can find, all the factors that I can find, the one I cannot find that does anything to the arterial wall is low density lipoprotein cholesterol. It does nothing.
Coming up on British Thought Leaders, Dr. Malcolm Kendrick says the idea that cholesterol causes heart disease is a con. Dr. Kendrick talks about the evidence behind his claim and how the medical establishment got this so wrong.
When you start seeing figures like that, you think, this doesn't seem right. Even if saturated fat does have a role, the role can be no more than 10%. And then when you start looking into it with the history of it, and you think, this was just made up, really.
He talks about statins, the most profitable and widely prescribed drug in the history of medicine.
The mainstream view is statins are side effect free, and the only side effects people think they get are all in their mind. They don't actually exist, which, having spoken to hundreds, thousands of people whose lives have been, in my opinion, crippled and ruined by these drugs, then yes, I think they do cause a lot of harm.
Welcome to British Thought Leaders. I'm Lee Hall. Today I'm sitting down with author and general practitioner Dr. Malcolm Kendrick. Malcolm, welcome to the show.
Thanks for inviting me. Yeah.
So the widespread belief is that eating saturated fat raises cholesterol, increases the risk of heart disease. And you're a doctor who spent years challenging this. You've written books about it. How did you come to the conclusion that this belief's not right, and why did you decide to speak out?
Well, when I was at medical school in Scotland, Scotland had the highest rate of heart disease in the world at the time. And so it was kind of a big issue for us. If you went through medical school, there was wards of men with having heart attacks at a young age. I mean, so it was of interest, but I was also interested. I used to travel to France and still do quite a lot. And I noticed one thing about France was they ate an awful lot of saturated fat.
Cheese,
and more cheese and meat. And, when you go skiing, if you go to a ski resort, it's almost an entire saturated fat diet. And France had a very low rate of heart disease, always has had, and it remains low. And at the time, it was about 1/6 that of Scotland for middle-aged men. So I sort of thought, well, it doesn't seem very likely that this can be the cause of heart disease, or even a major cause, even if it's only a minor cause. So I started looking at it, and I found that the French ate the most saturated fat in Europe and have the lowest rate of heart disease in Europe, yes. And then you can look at the statistics across Europe, and I found that the country with the lowest intake of saturated fat, and this is going back many, many moons, was actually Moldova and Ukraine and countries around that area. So they were eating about 5% saturated fat. The French were eating 15.5%. The Swiss were eating 15%, etc. And the rates of heart disease in the countries with the highest saturated fat intake was on average 1/10 of the rate of heart disease of the countries with the highest intake of saturated fat. I mean, we're talking, I think at the time France had 24 per 100,000 per year, and Moldova had 240. So it's 10 times as high, with 1/3 of the consumption of saturated fat. So when you see figures like that, interestingly, they don't publish these figures anymore. They're no longer available for consumption. You have to go back on Wayback Machine to find these things. When you start seeing figures like that, you think, this doesn't seem right. Even if saturated fat does have a role, the role can be no more than 10%. And then when you start looking into it with the history of it, and you think, this was just made up, really. It seems astonishing to say this, but the man who drove it was a chap called Ancel Keys, and after the Second World War, when heart disease appeared to first arrive in the USA, and the rates went up, and 50-year-old businessmen were dropping dead of heart attacks, and everyone was like, what's causing this? And the guy Ancel Keys said, I know what's causing this. You eat too much cholesterol, your cholesterol level goes up, and you die of heart disease. Now, you may know I've just changed from saturated fat to cholesterol. Everyone thinks they're the same thing, but they're not. So he went out and fed people very high cholesterol diets, and you mainly do that by giving people eggs, because they have the most cholesterol of anything. And he found it made no difference to the cholesterol level in the blood. So he thought, well, that can't be right. Oh, it must be something else that's like cholesterol or is associated with cholesterol or some other thinking that's very unclear said, oh, silly me, it's saturated fat. Right. So he just changed the hypothesis to fit what he thought were the facts. He then went around a whole bunch of countries and said, oh, look, when you eat less saturated fat, there's less heart disease. He included Japan and the US and Finland. He did not include Switzerland, France, Belgium, or other countries. He had 21 countries and he chose 7. And he drew a graph and went, the more saturated fat you eat, the higher your rate of heart disease, and it kind of looked like it would go up at stratosphere. The 7 countries study is just a nonsense study. But with no other ideas around, this one really caught hold. And then the whole cholesterol in your blood thing became a part of it. Even though at the time, he didn't know what cholesterol was in the blood. In fact, you don't have any cholesterol in your blood. So it all becomes, as you start looking into it, it's like it unpeels in front of your very eyes. So it didn't take me long to think, where did all this come from? Why is it so widely believed? How did it happen? And it happened, there's even stronger belief now. So, if you look into the history of it, I think that the other thing that happened was the cholesterol, or whatever you call it, hypothesis, again, it keeps changing its name, was being severely questioned in the 1980s, and then along came the drugs that lower cholesterol, statins, which most people will have heard of, the most prescribed drugs for most people in the history of drug prescribing for people. But, statins, last time I looked, had made $1 trillion in profit. Although they're now off-label, off-patent, so they don't make much money for the companies anymore. So there's new cholesterol-lowering agents. But statins, the trials were reported as showing terrific benefit from lowering cholesterol. Now, the trouble is here you have to get into figures and facts and what do these figures mean. And you sort of have to also believe the studies were absolutely ruthlessly objective, which sadly I no longer do. But I think that the one statistic that I hang on to when I speak to patients, because what a question you're going to ask, if I take these drugs, what do you want to know? How much longer will I live for? Probably. Yeah. If they save you from heart disease but you die of liver failure at the same time, you think, well, what's the point of that? So the key figure is, do you live any longer if you take these drugs? There was a study published in the BMJ about 10 years ago now, might be longer, where someone tried to work that out, because you're not presented with these figures. You're presented with, they reduce heart attack rates by 30% and they reduce this by 25% and whatever. But what do they actually do for life extension? Well, the study showed that if you take a statin for 5 years, if you're at high risk of heart disease, the average increase in life expectancy over 5 years is 4 days. Right? That's it. Okay. And if you're at low risk, sometimes called primary prevention, the average increase in life expectancy is 3 days. So it seemed to me that when you look at the figures this way, you're saying, really? And could they be doing this through some other mechanism, which is what I write and talk about a lot, which I believe that is the case. They do have some benefits in reducing heart disease, but it's really small. Is it worth it? Well, it's up to people to decide if they want 4 days of extra life for taking a drug for 5 years. Well, I can't say to someone that's not worth it, but I can say you would probably spend more time going to the doctor, getting a cholesterol check, taking the tablets. That would take more of your life than the number of days.
Depends how good the 4 days are, I guess.
How good are those 4 days? Well, that's another thing. Do they damage your health? Now, the mainstream view is statins are side effect free, and the only side effects people think they get are all in their mind. They don't actually exist, which, having spoken to hundreds and thousands of people who have lives have been, in my opinion, crippled and ruined by these drugs, then yes, I think they do cause a lot of harm. One of my things I say to people is, statins add 15 years to your life. And I go, oh, does that mean I'll live 15 years longer? I go, no, it means you'll feel 15 years older because they kind of, if you're achy, they'll give you more aches. If you've got a bit of, fuddledness in your mind and you think you're forgetting things, it will increase. And these are written onto the drug inserts, by the way. These adverse effects are written down when you get drugs. There's a long thing you get. You open it out and it tells you this is what the drug does and these are the adverse effects you might get. Well, these are all written down in the adverse effects of the patient information leaflets. I'm not making these up. And in fact, these are the legal requirement, because if they find these things in their clinical trials, they have to write them down. Now, what they then say in kind of quasi-marketing terms, they can almost say anything. But the FDA and the EMA and the MRC, they demand that you actually tell people what might happen. And they say these things happen. Up to 1 in 10 people might get muscle pains, memory loss, etc. So, yes, is it worth these things? So, the question here, and I know I've run through like the history of cholesterol and heart disease back to statins in one go, but I think that's what most people are interested in is, okay, you're saying cholesterol doesn't cause heart disease, but even if it did, what benefit do you get from taking statins? Well, the answer is, in my opinion, small. But I think you have to say to people, I'm just giving you the information. I'm not making this up. This comes from the British Medical Journal. This was a peer-reviewed blah, blah, blah. This is what it says. No one has ever contradicted those figures, by the way. I mean, they've said, oh, well, they only looked at 15 studies. And the arguments were not other than, well, we're not really interested in this. So I think that the answer of how did I get into this, why do I believe these things, I've studied it for years and years and years and years, and I realized saturated fat has got nothing to do with it. And the late Michael Mosley actually did a study, which was again published in the BMJ, where they fed people different types of saturated fat and looked at the impact on their cholesterol, the LDL, which is the nasty bit of cholesterol. And they found that coconut oil, which has the highest concentration of saturated fat of any substance that you can eat or drink, had absolutely no effect on your cholesterol level.
So what is behind heart disease? What causes it if it's not that?
Well, that's obviously I've written 2 books on that it's not cholesterol and it's not saturated fat. Stop worrying about it. This is nonsense, and be very cautious about lowering your cholesterol with drugs. But I'd been stuck for many years. Now, I started off thinking I believed it was stress, although the correct word is strain. Stress is the force applied to an object. Strain is the resultant deformation. And in fact, the guy, the Hungarian whose name has just gone off my mind, who coined the word stress, said, had I known English better, I would have called it strain. Right? Because sometimes when I give talks and I stand up and there's, say, 500 people listening to me, I say, there are people who, if they were asked to do this, would be absolutely, at their wits' end. They'd be shaking. They'd feel terrible. They'd be so anxious they could hardly move. Whereas I go up and give a talk and I can quite enjoy it. So the same, if you like, the same stressor, giving a talk, can cause 2 people to have entirely different reactions.
You talk in your book about people who've been moved from one place to another as well.
Oh, really important. I mean, the highest rates of heart disease in the UK currently are with Asian Indians, and primarily Muslim Asian Indians. And in fact, Muslim, you get the terminology, people from South India, Bangladesh, Pakistan, India itself, that move to almost anywhere in Europe. So in Sweden, they have 5 times the rate of heart disease. In the UK, they have 5 times the rate of heart disease. And you can look at the States and say, why did they get such a high rate of heart disease? Well, they had a huge waves of immigration in the 1930s. Then they had the Depression, then they had the war, then...
This is the strain of all these things. Right.
Some people aren't strained by these things. I mean, if a professor of theology moved from Oxford to Harvard, their lifestyle and everything about it would be exact. So it's not the physical location, it's the cultural relocation. And one of the countries, there's a couple of areas that are fascinating, is Finland had the highest rate of heart disease in the 1960s. And you think, well, Finland, everyone's happy there. It's a country and they've got these words for being happy. But what most people don't know is the largest proportional forced relocation of people in history moved out of the northern Finland called Karelia into Karelia because the Russians kicked them out. And that region of Norway had the highest rates of the highest rates. It's now come down and their rates are quite low. And in Scotland we had around Glasgow, where the heart disease rate was the highest, 600,000 people were moved out of Glasgow because of the tenements and the slums and put into these new towns surrounding it, which are all pretty grim if you've ever been there. They're like little boxes, so to speak, and they ripped communities apart. So you can see this happening. The other interesting time was at the breakup of the Soviet Union.
Right.
And although communist life was not exciting or well off, or it was very predictable, and it was quite controlled, and people were quite just got on with their lives. As the wall came down, and one of the countries that showed the biggest change was actually Lithuania. Now, if you look at the Lithuanian heart disease rates, and we know these are accurate because the monitoring centre from the WHO was set up there, the heart disease rates are gradually coming down, down and down. 1989, they go like that. They double over a 2-year period, and then they come crashing back down, and then they're back. So you've got this Mount Everest sitting in the middle. For years I looked at their statistics and thought, they're just making them up, aren't they? And then I realised, you look at all the other countries and they were showing the same thing. When the Soviet Union broke apart, when Lithuania and Latvia and Estonia underwent these enormous changes, their heart disease rates went shooting up. Same thing happened in Russia 2 years later, because if you like, communism went out of Russia 2 years after Lithuania, heart disease rate went shooting up, came down. Then they had an enormous banking crisis in 1999, and the heart disease rate shot up again and then came down. So you can look at elements. I mean, I said before COVID, we'd all this lockdown, we'd all this social stuff. I said the heart disease rate will go up after this, and it has. It's gone up by 20%. Now, it's not going to go up as much because the dislocation and the damage was not as great, but in my opinion, and these things are difficult to prove, but I did say this is going to happen, and it did, which is one of the reasons I was so anti-lockdown, because I'd seen what social, I use the word dislocation, I don't know if that's the right word, but I think people understand it. You take people out of their environment, take people out of their life, you subject them to highly strainful or stressful situations, and their heart disease rate just goes through the roof. And you can look at the people who have the highest rates of heart disease now, schizophrenics, huge mental stress. Schizophrenics, their pituitary glands are twice the size of a normal pituitary gland. Pituitary gland sits in your brain and it coordinates the entire stress response in your body. They have enormously high levels of adrenaline and cortisol and blah, blah, blah. People with PTSD, vastly raised rates of heart disease. People with severe depression. It was discovered during the First World War that men with shell shock, which we now call PTSD, I think, they became so stressed and anxious that actually they started to have sugar in their urine, which is a sign of severe diabetes. Right? And that's a sign of severe stress, because the stress hormones battle against insulin and your sugar level goes shooting through the roof. So the mental state, your mental state, and then they looked at people in Lithuania and matched them with people in Sweden. And they're very similar genetically. And what they found was, and this was when the rate was very high in Lithuania, that these people were suffering from clear signs of mental strain. The cortisol levels had shot up and then they came crashing down. Their adrenaline levels were up. They were more depressed, etc., etc. So I do believe, I'll call it stress because everybody else does, and call it strain and everyone looks at you, what are you talking about? Strain. And so I do believe that, and when I looked at the French, I thought, it was very important that when they sat down and ate, they sat down as a family, and when they ate, they were eating in a relaxed fashion, and they were drinking a bit of wine with their meals, and etc. And that became as part of their lifestyle. Whereas in Scotland, and I know, a meal at 5 o'clock was, where's my tea? Bam, eat, out to the pub. So it wasn't what you ate necessarily that was the bad thing, it was kind of how you ate it.
Right.
Now, I still believe that's true, but obviously then there's all sorts of other things as well that you can say, well, where's the stress associated with that? It doesn't exist. You could say smoking releases some stress hormones, but not really. Diabetes, I mean, it can be triggered by stress, but in generally it's not. It's triggered by eating the wrong foodstuffs and becoming overweight and becoming insulin resistant. That's not stress particularly. So you can start finding things that are not stress. And my view is quite sort of sort of black and white, is if you can find that someone has a disease and the factor you think causes it isn't present, then something else is going on, right? So which is why I got stuck for so many years, because every time I looked at something, I thought, how does that fit with that? How does that fit with that? I couldn't get them together, right? Because every time I did, something else would pop out and go, well, what about that? And I was like, you're right, I can't fit that in. So a very, very clever man, and in fact, he set up the American Institute of Stress, Professor Paul Roche, now sadly dead, although he lived a long time. He said to me, we were sitting, and I said, I just can't do this. I'm giving up. I can't put it all together. He said, look at the process. And then he walked off, and I thought, what are you talking about? Help. That's no use to me. And I started looking at the process. And by process, I mean what's actually happening with the disease. What are you looking at? What is happening here? And of course, we call it heart disease, but it's really the disease of your arteries that supply blood to your heart, and the arteries that supply blood to your brain, and the arteries that supply blood throughout your body. They become thickened and narrowed, things called plaques that thicken and narrow them. It's a bit like you've seen pictures of pipes that get fat in them that narrow them down. Well, I don't like using the analogy for various reasons, but people can understand that one quite easily. So basically the tubes get narrowed. The tubes get narrowed, there's less blood getting to your heart, then a blood clot will form over the narrowing, and then that will be a heart attack, or it will form over the blood vessels in the arteries in your neck, and that can cause a stroke, or it can do it in your kidneys or your bowel or anywhere really. So the disease is a disease of arteries, only arteries, and it's a thickening. And for many years, people looked at the thickening and said, we can find cholesterol in there. I said, yes, you can. You can also find all sorts of other things in there, so why is it not them? There was a guy called Ronald Ross in the 1970s who said the response to injury hypothesis. He said what happens is the blood vessels are damaged in some way, a clot forms on them, and that becomes the basis for the plaque developing. Now, he was quite famous at one point, and research seemed to be going that way. Then along came statins, and bang. But I was actually educated at Aberdeen University by a lady called Elspeth Smith, who's a cardiologist, doing research into this area, and never got the chance to speak to her about her ideas. The greatest regret I have. She said, basically, every aspect of what we call heart disease, atherosclerotic plaques, is due to blood clotting. It causes it to start in the first place, it makes it grow, and it causes the final blood clot that might be the heart attack. And she was writing this in the early 1980s. And I looked at papers by E. Smith. I started reading papers by E. Smith. I didn't put it together. That is Elspeth Smith. So I thought that was E stood for Edward or something, because women are not cardiologists. They certainly weren't in that era. And I read this and I thought, well, she worked it out. She added it, this is it. What happens is there is damage to the lining of the blood vessel, and it doesn't happen in your veins, and it doesn't normally happen in your lungs because their blood pressure there is very much smaller and the flow is much less, and the stress placed on the lining, they call the endothelial cells, is much less. So if you take a vein and put it in the heart as a coronary artery bypass graft, it will develop plaques very rapidly. So it's not that veins can't become atherosclerotic. It's that they don't, because the blood pressure in your veins is about 3 on average, and in your arteries in your body is about 100. So it's like 30 times higher. It's about 10 or 15 in your lungs. But if you increase the pressure in your lungs through having a hole in your heart or having a vein going into your heart where it should be a vein, an artery, you can develop it. So I started thinking, well, this is the process. The process is this. You damage the lining of the blood vessels. A blood clot forms, as it must, because the body thinks my artery is damaged. I've got to protect myself from bleeding to death. And then it stops, mainly, hopefully, so you don't have a heart attack or a stroke or whatever else that you could do. Then it's repaired. I hate to say this to people, in your arteries right now, little clots are forming. They're being repaired and they're going away. It's a bit like your skin's being damaged all the time, a bit. But in general, it clears up and you aren't even left with a scar. But if you damage it enough, then you're left with a problem. And the other thing is, of course, if you scratch your skin and you get a bleed on your skin, it bleeds and then you get a scab. and then the scab falls off. Well, if that happened in your artery, if the scab fell off and travelled down the artery, it would just block it up further down. So the body can't allow that to happen. So it's developed a system for covering it over, drawing it in, and getting rid of it. So what causes heart disease? It's things that damage the lining of your artery repeatedly, more frequently. So smoking a cigarette, that does it. Car exhaust fumes, that does it. High blood sugar levels, that does it. All sorts of things. I've got 200 at the back of my head that I could come out with. And my analogy is, it's like paint on a car, is that it can become scratched. And then once it's scratched, rust will develop, right? Now, what can damage a car to scratch it? Well, if I sat down with you and you could come up with 50 things, a rock, a stone, a shopping trolley, another car, a key, they can all scratch the paintwork. So what connects them together is not what they are. So what connects a key and a stone and a shopping trolley? Nothing. It's what they do, what they can do. So if you can find something that you know can damage the artery wall, like very high blood pressure, for example, turbulent flow, because most of these plaques occur at points where the arteries branch off, and right there is where you're getting the greatest strain on the artery. If you can find something that does that, then it can be seen to be a cause of the first step, which is damaging the artery wall. That's simple. Then you find the thing, well, what happens in a clot forms? Well, if the clot is a normal clot and the clots form and they get stopped forming and then they get shaved down, last time I looked, 42 different factors were involved in creating blood clots. They're floating around in your bloodstream. It's really complicated. And there's another 42 that say, I'm stopping it. Because if every time a clot started, your entire body would just become one big blood clot and you'd be dead. So it's a constant flux situation. So things that can increase the risk of a big, nasty blood clot that's less likely to be, or less simple to be got rid of or shaved down. And such things are clotting factors. And there are many. And one of the interesting ones is fibrinogen, which is a protein that sticks together to form fibrin, and that wraps around a clot, and it's very sticky and resists breakdown. If you have a high fibrinogen level, your risk of heart disease is way up there. There's several factors that can do this, and you'll find every single one of them increases the risk of heart disease. So you may have heard of haemophilia. People's blood doesn't clot as well. Factor VIII is the thing that they lack generally, although there can be other factors. And before the new factors came along, and after that terrible disaster where they gave children hepatitis C and AIDS and everything, that people with haemophilia had really low rates of dying of heart disease, right? Very low. And people who have high clotting factor rate, of high things that make their blood clots more difficult to remove, have high rates of heart disease. End of. And then the final factor is obviously the repair system, because if the repair system is working, so when you're young and fit and fancy-free and you're smoking cigarettes, your repair systems are la-di-da and papering it over and getting rid of it and everything. As you get older, however, the repair systems do this horrible thing that the rest of our body does, which is they don't work so well. And as you get older, so the biggest risk factor for heart disease is age. Now, you may think that's obvious. I spent a lot of time trying to work out, why does this disease affect people more as they get older? What's the thing that's going on? If you ask people, it's kind of like, well, it's gradually developing over years and years. It's just not. A lot of diseases affect younger people more than older people. So why does something affect people who are older more than younger people? And that is the answer. Your repair systems just don't work so well. And the other thing, if you look at, there is a drug that directly stops these new layers from being formed and the protection occurring. And they're used in cancer treatment. And the first of them was, ironically, thalidomide. Thalidomide stops blood vessels from growing because it blocks a hormone that makes blood vessels grow and keep them healthy. And that's why the arms became shortened, because at a certain stage in the development, the blood vessels couldn't grow, so the arms and legs couldn't grow. Right. So you ended up with no arms and legs. That's thalidomide. That's what people think of, right? It's still used as an anti-cancer drug. It's not called thalidomide anymore. And the reason they use it is because if you have a tumor, tumors fire a hormone that says it needs more blood vessels to supply it with nutrients, and it grows. And if you block those new blood vessels growing, it dies. They are used, these drugs. However, they have the side effect of causing a great increase in the risk of heart disease, unsurprisingly, because the repair systems are being interfered with. So essentially, it's very simple, and it's the sort of simplest thing ever. You know, if you want to avoid heart disease, try and stop doing things that damage your lining of your arteries in the first place. Smoking, stress does that. By the way, the stress hormones do this. Exercise is very good because it releases other agents that protect your blood vessels, etc., etc. You know, cocaine is terrible for it really damages your lining of your blood vessels, really increases the risk of heart disease. Having diabetes, raised blood sugar level, etc., etc. And once you look at it in this way and saying, does a factor cause one of these three things to happen? And if it does, the rate of heart disease will go up. And if it doesn't, it won't. It is actually as simple as that. But of course, they all interact together, and there's 50 things can do this, and 20 things can do this, and whatever. So when someone says, well, I've got normal blood pressure, and I've got normal cholesterol, I've got normal this and normal that, and I've still got, they can see that I've had heart disease, what's caused that? And I go, well, it might be quite difficult to find out. Because another factor that was very fascinating to me was lead. All right. Now, if you go and speak to 100 doctors and say lead causes heart disease, I go, what are you talking about? But we don't have so much lead in the environment now, but it was calculated that lead caused 160,000 heart attacks per year in the United States. Right? Now, what does lead do? Well, what lead does is lead gets into your body and it stays in your bones for decades, and it's gradually released. And the first thing it does is it attacks the lining of your arteries. Right. So there's gradual damaging to your arteries going on. So now there's less lead. That's one of the reasons why heart disease rates have fallen quite so, along with people smoking less. Another thing that can cause it is actually, and this is another one which I found fascinating, is gingivitis or infection in your gums, periodontal disease. Mm. So, well, how can disease in your teeth cause heart disease? Yeah. Well, I'll tell you exactly how it does it. Because the bacteria in your gums is gradually releasing a thing called an exotoxin, which is basically the waste product of a bacteria. Right? As they grow, they shed nasty things. These float around in the bloodstream and they attack and damage the lining of your arteries. This is exactly how it works. And in fact, that's how COVID caused heart disease and increased deaths from heart disease as well. Because the COVID virus works slightly differently, gets into endothelial cells. It uses a protein on the side of endothelial cells to get in. Gets into the cell, starts multiplying. The cell sends out messages saying, I've been infected, please come and destroy me, to the immune system. The immune system goes, okay, then comes, attacks the lining of your artery walls and kills them. And you might have heard of a thing called, people might have heard of the cytokine storm, which is the thing that killed people. Cytokine storm. Cytokines are protein molecules that are called transmitter or transmission of information. A cytokine basically transmits information. The cytokines at high level are saying, we're under attack. The immune system revved itself up into a kind of super state, started stripping the blood vessels, and then people were dying. So if you gave things that could control the cytokines, then the level of heart disease fell, and that steroids, and they found that in the studies they did in the UK. And everyone was like, how's this happening? How's this happening? Well, this is how it's happening. I wrote about this before it happened, all right? I told various people that were listening, this is what is happening, this is what you should look out for. Because once you understand what causes heart disease, you could see this would cause heart disease. As we call heart disease, blood clot, heart attack, stroke, all those things that happen. So there's a kind of frustration I have in saying, look, it's this, you can read about it. If you find anything that contradicts it, let me know. Because I can't. Go and thank Elspeth Smith, Ronald Ross, Carl von Rokitansky, J.B. Duguid, American guy whose name I've forgotten. They'd all worked this out. You know, all I looked for was what I call the ghost in the machine. You will always find there are people saying stuff and no one's paying any attention to them, and it's always there. When it comes to medicine especially, somebody's always been saying, it wasn't that, it was this. All I've done is, I hope, is I've amplified their voices and said, they were right, this is it. And forget about cholesterol, because of all the substances I can find, all the factors that I can find, The one I cannot find that does anything to the arterial wall is low density lipoprotein cholesterol. It does nothing. So if that hypothesis is right, mine is wrong. If mine is wrong, theirs is right. But, and I can't go into any vast detail, but actually cholesterol does not cause heart disease.
Join us for part 2 of this interview when Dr. Kendrick talks about the murky world of medical research.
Lifetime use, preventive drugs that you're taking forever and ever, these are the ones the industry is most interested in, because it means millions of people are taking them for years and years and years, and the money just rolls in.